Well, good afternoon, everyone, and welcome to our daily COVID-19 update briefing. Yesterday, I noted that 5 of the 7 regions not scheduled to experience additional mitigations were above a 7% positivity average. Unfortunately, all 7 of those regions are now above a 7% positivity threshold. We also continue to see concerning trends in hospital admissions across the board. In particular, I want to note that Region 7, set for additional resurgence mitigations on Friday, is showing less than 23% remaining ICU and med-surg beds capacity at this time, while continuing to see increases in COVID-related hospital admissions. Regional trends are still moving in the wrong direction. In addition to mitigations being imposed to help bring down the spread of the virus, I want to remind everyone, mask up, Illinois. Keep your distance, wash your hands, get your flu shot, and think twice before taking unnecessary trips and getting together with people who don't already live with you. I also want to share with the public today 2 major updates. One about our vaccine distribution plan and one about our testing infrastructure. To be clear, there is no approved vaccine yet. But today is the day that my administration is updating healthcare providers and local health departments about Illinois' vaccine rollout framework. So I want to share that same update with the public. This plan will evolve as vaccine trials come to a conclusion and the FDA decides which to approve. First, I want to provide some background. Not long ago, the CDC asked every state to create a specific COVID-19 vaccine distribution plan in line with the agency's recommendations. Our framework in Illinois is designed to provide an equitable distribution across the state, with priority access going to our most vulnerable populations. That includes, for example, frontline healthcare workers and first responders who directly interact with and treat COVID patients, as well as staff and residents in long-term care facilities. The challenge of designing a plan now, of course, is that there's so much about the vaccines that we don't know. For example, will a successful vaccine require 1 or 2 doses? And how far apart must those doses be administered? Will the vaccines require cold storage, or can they be stored at room temperature? If vaccines are distributed in large case containers, how will those cases be split up in smaller numbers for delivery to small healthcare facilities throughout the state? So the most defining characteristic of this plan is that it's adjustable as we go forward and learn more. And you can expect transparency with that too. IDPH is coordinating with qualified providers and healthcare networks to ensure that everyone who can administer the vaccines has properly completed the state enrollment process. That's called iCare, the same registry that tracks immunization records for children. This will also help ensure all providers meet the standard vaccination storage and handling requirements. Working through iCare means that we're being as efficient as possible in our preparations for when a vaccine is ready, all while ensuring safety every step of the way. Let me be clear, Illinois will not distribute a vaccine until we have one that is proven safe and effective. We have a highly qualified team of experts from the private and public sectors teamed up to evaluate the public data and process when the vaccine data is made available over the coming weeks or months. And I'll make sure that you can hear from them when the time comes. My second major update today involves testing. Today marks our first shipments from the state of Illinois to local health departments around the state, carrying more than 170,000 Abbott Binax Now tests. These are the rapid antigen tests recently purchased and distributed to states en masse by the federal government. The federal government and Abbott have indicated that these shipments will continue on a weekly basis through at least the end of 2020 and will total over 3 million tests for the state of Illinois. I want to make note with some real pride that these tests are manufactured right here in our state, and Abbott has hired over 2,000 employees in their new plant in Gurnee to manufacture them. Now, this is another example of where there's no formal national plan. Every state will have a different approach in using these Binax Now tests. Here in Illinois, we're viewing these tests as an important additional tool in our testing toolbox. We are piloting their usage in several different settings in order to gather more data about their accuracy and sensitivity, and then adjusting our plan to achieve the maximum impact so we can battle COVID-19 the best we can. For now, the majority of the initial tests delivered to us are going to local health departments directly, ensuring resource access and flexibility on a local scale across the entire state. That means, depending on the needs of the community, the local health department can choose to distribute their tests for any of a number of localized needs, including for K-12 settings, first responders, federally qualified health centers, and homeless service organizations, as well as an array of other options. The state will also use early shipments of Binax Now to launch focused pilot testing programs in K-12 institutions, in long-term care facilities, as state-owned residents, in state-owned residents, such as veterans' homes, and additional priorities as they arise. The federal government is also separately sending Binax Now tests directly to long-term care facilities across the country, including here in Illinois, a process that started a few weeks ago. This selection and delivery is outside of the state's control. Currently, this Abbott Binax Now test has FDA emergency use authorization for people suspected to have COVID-19 within the first 7 days of symptom onset. In other words, we're still learning about what the test's role could be in screening efforts and other settings. Here in Illinois, we'll take what we've learned from the data about accuracy of results and scale up or adjust our programs as needed. At the end of the day, our main focus is just getting the best tests out to as many people as possible. We've had more success in that effort compared to many other states, and we'll keep working at it as long as we're fighting this pandemic.